Hey guys, in this video, we're going to go through a really interesting case, one that looks simple on the surface, but if you miss the subtle clues, it's easy to misdiagnose. So let's jump straight into it. All right, so we've got a 43-year-old male who comes in and says, "My gums are swollen and bleeding around one of my back teeth." He says it's been going on for a couple of months, no pain, just this localized swelling and occasional bleeding when he brushes. No systemic symptoms, and he doesn't smoke or anything like that. So we take a look clinically. There's a red purple lesion on the buccal gingiva next to tooth number 36. It's kind of soft, bleeds really easily when we probe it, and it's pretty localized. Nothing else in the mouth looks like this. The tooth itself is vital, no mobility, and the radiograph shows vertical bone loss right next to the distal root of that molar. There's no major calculus or deep pockets either, just some mild plaque in the area. All right, so let's walk through the possible diagnoses. First, we've got pyogenic granuloma. And yeah, it does sound reasonable at first. It's usually a soft reddish lesion, bleeds easily, and it's often seen on the gingiva. But here's the thing, pyogenic granulomas don't usually cause bone loss. They're mostly soft tissue lesions, no underlying resorption or anything like that. So even though the appearance is kind of similar, the radiographic bone loss makes this one less likely. Next, we've got a periodontal abscess, but a few things just don't line up here. Abscesses are usually painful, right? And you'll often get swelling with pus or drainage, and it's typically related to a deep periodontal pocket or heavy calculus buildup. In this case, the patient isn't in pain, there's no purulence, and there's really no active periodontal disease going on. So, yeah, doesn't quite fit either. Then there's localized chronic periodontitis. That one's a bit tempting, especially because we see bone loss, but again, the presentation doesn't really match. Chronic periodontitis tends to affect broader areas, not just this one specific site, and it's usually not associated with a distinct bleeding mass. The gingiva here isn't just inflamed, it's a visible lesion. So, yeah, I'd say this one's not likely either. That brings us to peripheral giant cell granuloma. And honestly, it just checks all the boxes. It's a reactive lesion that appears on the gingiva, often from local trauma or irritation. It has that reddish blue or purple color. It bleeds easily. And this is super important. It often causes underlying bone resorption, especially the kind of vertical bone loss we're seeing in this case. It's usually soft to firm, depending on the stage. And it's often confused with pyogenic granuloma. But again, that bone loss is the key difference here. So yeah, the correct answer in this case is peripheral giant cell granuloma. All right, that's it for this one. I hope it helped you see how these gingival lesions can look really similar at first, but the details like radiographic findings, texture, and bleeding can totally change the diagnosis. Thanks for watching, and I'll see you in the next case.